Now that we've talked about health promotion and illness prevention, let's talk specifically about combating substance abuse. Because substance abuse has an enormous toll on society. The textbook spends paragraphs listing all of the costs in terms of lost work, um, damages due to accidents, the health costs based on all sorts of different kinds of substance abuse. So things like alcohol, tobacco, opioids, and cannabis. The estimated total cost, when you take into account like lost hours, damage, health problems, all of that, they've put it in the range of almost $40 billion in Canada alone. And so even if we just look at alcohol, which is a legal substance in many countries around the world, the WHO estimates that about 3 million deaths every year are the result of misuse of alcohol. Whether this be due to drunk driving accidents or long-term health consequences from heavy drinking, alcohol-related suicides, all sorts of things all combined together, massive drain on the world. If we consider the societal costs of alcohol abuse, we can look at percent of crimes that are alcohol related. So if we start at the top looking at intimate partner violence. So this would be violence between, say, a married couple or boyfriend-girlfriend, girlfriend-girlfriend, boyfriend-boyfriend, whatever kind of combination of intimate partners you have. They're saying about 66% of those kinds of violent crimes have some kind of alcohol related. So maybe one of the partners is drunk, or maybe their drinking has something to do with it. Massive portion of those kinds of crimes are influenced by alcohol. Child abuse has a high link with alcohol, and homicide and sexual assault and physical assault, even robbery, ends up having about 15% of robberies have some link to alcohol. So clearly a really big effect on society. So if substance abuse, and specifically alcohol use, is such a negative factor, how can we start getting people away from it? How do we fix the problem? And unfortunately, we see a lot of disappointing results from traditional psychotherapy. So if we use something like psychodynamic approaches or even some biological treatments, they end up not being overly helpful in convincing people to stop substance abusing. One of the best approaches ends up being sort of cognitive behavioral approaches. They seem to be the most cost-effective and successful in reducing abuse. So we're going to talk about one of those techniques, which is motivational interviewing. So the goal of motivational interviewing is to try and get the person to get to the conclusion that you want them to get to, but they do it themselves. So you can ask questions that focus on discrepancies between the individual's current state of affairs and their ideal self-image or their ideal behaviors or desired outcomes. So maybe if you ask someone about their drinking problem, and they don't want to admit that they have a drinking problem, but if you ask, okay, well, how much do you drink a day? And how much would you like to be drinking a day? And how would it help if you could reduce the amount of drinks that you have every day down to your ideal amount? How would that change your life? How would you benefit from it? And so the counselor provides guidelines and feedback and sort of lets the person talk and come to their own conclusions. So once the client or the person being counseled has decided that they want to make a change, then maybe the counselor can give them some guidelines on how to change and can check in to make sure they're sticking with it and that they're seeing the changes they want to see. And in terms of this being a cost-effective and actually effective method of treating substance abusers, one massive study found that looking at alcohol abuse patients, a 4-session motivational interviewing program like this proved just as effective as a 12-session program based on Alcoholics Anonymous. So it's pretty effective and takes up a lot less time and therefore resources. But as you might expect from everything we've talked about during this course, not every situation is going to work with this one particular method. Substance abuse of any kind is a complex topic. It has lots of different factors influencing it. There are behavioral factors, environmental factors, biological factors, all sorts of things contributing to it. So one technique isn't always going to solve the problem. It isn't always going to be the best course of action. Sometimes we end up relying on what are called multimodal treatment approaches. And if you break down the title of it, multimodal just meaning using a lot of different techniques, using a bunch of different treatment options to try and get to the desired outcome. So in this combination of techniques, you could see, let's say, biological measures. So if someone's trying to stop smoking, maybe you employ nicotine patches to try and get rid of the cravings that come from no longer smoking. Might also see learning techniques. Could use something like aversion therapy, where you try and get people to associate the behavior they're trying to stop with something bad. So they have an aversion to the behavior and maybe stop doing it. You can see things like stress management, giving people coping skills. Basically give people the tools to avoid being stressed and having to rely on maladaptive things like drinking. So if you're not so stressed and you're not having trouble coping with stressful situations, then maybe you'd be less likely to want to have a drink. And the last thing you might see would be something like counseling. You could sit down and talk through problems, maybe get to the bottom of what's leading to this substance abuse, maybe solve some family problems or any kind of counseling that might help. So a mixture of all sorts of different types of techniques. And again, as you can imagine, we're going to see different levels of effectiveness based on which combination of treatments you see, which situation we're in, and even the person who's being treated. But across multiple studies, we see about 65% of people who had been abusing alcohol were no longer abusing alcohol 1 year after treatment. Unfortunately, if you look longer than a year after the treatment, the long-term outcomes seem to be a little bit less favorable. You tend to see about a 30% maintenance rate for things like alcohol abuse, smoking, and other related substances. So long-term, only about 30% of people manage to completely get rid of their problem. But it's still better than nothing. So if so many people are going back to their maladaptive behaviors, if they're going back to abusing substances, what's causing these relapses? If we want to get to the bottom of this to try and help prevent those relapses, let's figure out what's going on. So before we do that, we'll mention just one more time, I've mentioned it once before in this chapter, but a relapse is a return to an undesirable behavior. So that idea of smoking cigarettes and you stopped smoking, you didn't smoke for months and months and months, but then something caused you to slip and all of a sudden you were back to smoking every single day. That would be a relapse. A lapse would be a one-time slip. So if you had stopped smoking, but you have a terrible, terrible day, maybe you're dealing with a lot of trauma, and you decide that you need a cigarette right now. If that single cigarette is the only cigarette you smoke, and then you go back to not smoking again, we would call that a lapse. So most of what we're going to be talking about here are dealing with relapses because they're a lot more harmful because you're returning to that undesirable long-term behavior. So here we have a model of relapse prevention. So this model is telling us that relapse is going to be most likely to occur if we don't have adequate coping skills to deal with a high-risk situation. So if we look here, we have a person encounters a high-risk situation. Maybe a recovering alcoholic is offered a drink by a new person at work that they've never met before, not realizing they're an alcoholic. So they're put in this high-risk situation of, hey, here's a beer. If they have a decent coping response, if they've sort of been through lots of different treatment approaches and they've been given all the tools to cope with this situation well, they can experience this increased self efficacy. They have that idea of, I can handle this. I can say no, it's not a big problem. I've got this. So they're going to have a decreased probability of relapse because they had the tools that they needed to say no. If someone doesn't have the proper coping response, if they have inadequate coping skills, if they weren't given the right tools, they're going to end up with decreased self-efficacy. Maybe they don't feel confident in their ability to say no. Maybe they still feel like they need this. Instead of just that decreased self-efficacy, maybe they have this positive outcome expectancy. Basically, the idea that taking the beer and having a drink is going to make them feel better. Maybe they're expecting those initial effects of the substance. So someone who stopped smoking, maybe they think fondly of how calming it used to be to smoke. Or someone who used to drink thinks longingly of how relaxing it was to have a drink. That positive outcome expectancy makes them a lot more likely to give in, to accept the thing being offered to them. And either decreased self-efficacy and or positive outcome expectancy can lead to an initial use of the substance. So they take the beer, they have one drink. What's one drink? At this point, that individual has experienced a lapse. It is a single event. And now we enter this critical stage. So this reaction that we're going to talk about next is called the abstinence violation effect. So the person is probably going to get really upset and start blaming themselves over their failure to maintain their abstinence. So I was weak, I had a drink, I'm a terrible person. And then maybe they're going to start thinking that they were never strong enough to have resisted temptation in the first place. They start internalizing. This lapse is proof that I would never be strong enough to stop drinking. Clearly, I just had a drink, therefore, I didn't deserve this in the first place. So this sense of self-blame and hopelessness makes people at pretty high risk to abandon their attempts to change and can lead to a total relapse. If they're so far gone at this point, if they think that they never had a chance, that this is all their fault, they're a terrible person, why did I even bother? They might give up and go back to drinking because clearly not drinking wasn't for them. They weren't capable of it. It doesn't matter. On the other hand, people who have sufficient coping skills, even if they got to this situation where they had had a slip, if they initially used the substance, if they had a lapse, they might be able to sort of channel that energy a little bit more effectively. And instead of becoming helpless and feeling like they're a failure, maybe they would feel a little bit more confident in their ability to handle these situations and say, hey, okay, I had a lapse, but I can do this. And then they would be less likely to go all the way to a relapse. They would just use it as a learning experience. Maybe they're able to cope better in the future. They're like, okay, well now I know that I don't want to go to a bar with a friend without telling them that I'm a recovering alcoholic. Maybe I'm going to avoid bars, period. Maybe I'm going to avoid places that serve alcohol. So you can use those situations to learn and grow. So you develop coping mechanisms from sometimes falling down the wrong path. So there's a couple of different ways you can handle these different situations based on this fairly simple model. Another approach that we might see is something called a harm reduction approach to prevention. And so for harm reduction, the goal isn't to eliminate a behavior, but actually to reduce the harmful effects. So instead of completely stopping drug use, maybe use something like methadone to help people ease off of more intense substances. Instead of completely stopping drinking, maybe get someone to commit to reduce their binge drinking. So drink in a more reasonable manner instead of all the time. Programs like needle exchange programs, where you're not discouraging drug use, but you're trying to get it to happen in safer environments, more controlled environments, less risky environments. So they're trying to reduce harm. And by reducing this harm, they can actually start reducing the cost to society. And so if we want to see one of these programs in action, we can look at this image from the textbook, which is looking at harm reduction treatment for specifically binge drinking and alcohol. So people who were at high risk and consumed a lot of alcohol, especially in binge drinking scenarios. And this was looking at individuals on campus. So they have three different groups here. So they have high risk controls, so people who drink a lot of alcohol, who are at high risk of binge drinking, but weren't given any treatment. That's the blue line here at the top. Our red line is high-risk individuals who were in an intervention group. So in this case, they were treated or they went through motivational interviewing to try and encourage them to drink less. So the goal here was to reduce the binge drinking. And then we can look at our green group, which is a randomly selected group of students. These are our control group who have no risk of drinking. And so in the graph here, we have our baseline. So when they were first brought into the study, 6 months later, 1 year later, and 2 years later. And we have just a score of drinking problem scores. So how harmful is drinking in their lives? And so understandably, our randomly selected students scored fairly low in problem drinking and maintained that throughout the course of the study. Our individuals who were high-risk controls, who had no treatment, seem to show a pretty high problem drinking score no matter what. And our red line here ends up being lower than our control, so still high risk, but because of their intervention, because of that encouragement to get away from more harmful binge drinking, they were able to reduce their score over time. And so they're showing a much lower score than our high-risk controls over time. So even with a brief intervention, even with just that very quick motivational interviewing technique, we see this long-term effect, and it's a pretty dramatic effect. So binge drinking reduced in this group. And this isn't just specific to alcohol. You can have this according to all sorts of different kinds of substance abuse. So you don't have to completely get rid of the problem, but you can sort of mitigate it, reduce harm, and have some benefits overall by following this kind of a method.